This gentleman came to see me this morning with tremendous pain in the neck. He's been doing some physical work and it's been hurting. The whole of the neck is hurting, and he's also getting some headaches, fatigue, blurred vision. He can't see very well. The vision has deteriorated over a period of time. So he came to see me this morning with all these symptoms. Now, here's the model of the neck. So there are two types of problems for the neck. One is connected to the muscles which are attached to the occiput on one side and the other parts of the spine. So, and the joints, the joints here, the facet joints, when they move, they cause spasm. Then of course the nerves. Now these nerves emerge out of the neck, so they can be scratched either by osteophytes or bony growths in all these joints, around these joints. They scratch the nerve and you get pain down the arm, in the shoulder, in the fingers, goes down to the fingers. So you get all sorts of neurological pains. And so this has to be dealt with massages. I don't think we need manipulations. We should avoid them as far as possible, but they can be organized with my technique of physical therapy. That's one type of problem. The second type is we have a pair of arteries running right through the canal in the cervical spine, this pair of arteries here. And what happens is that these arteries supply blood to the autonomous brain or the subconscious brain. So in that we have the cerebellum, which causes dizziness, imbalance, and so many different types of problems. You have the pituitary, which controls the hormones, so you get hormonal problems, palpitation, sleep disturbances here, emotional problems, then also some neurological problems like Bell's palsy and all that. All that is controlled from here. So you get problems of blood circulation, when less blood flows into this part of the brain, you get different types of problems. So the gentleman is getting headaches and he's getting problems with vision because they're all connected to this part of the brain. And so we have to treat both sides. So let's start with the physical problems, which is the main thing. We start off using this massager. It's a common massager. You let it run, it vibrates. So you start off. This is where all the neck muscles are attached. So all the tendons of the neck muscles are here. When there's problem in the neck, these tendons, they get affected. So you massage the occiput area. Very important, they usually hurt. And there's neck problem. Do this for about 3-4 minutes. If you look at the neck, well, here's the neck. So you have, this is the cervical spine. So this is where all the joints are, right? And then you have the muscles here, all the neck muscles, and you have the center of the spine, right? So you always stay behind the ears and massage this part first, going down on both sides. Then you do the massages of the muscles which are here, right down, keep rubbing them. You'll find many sore spots. And then the center of the spine, which you can push slightly on one side, the other side, one side, the other side, like that, both sides. So this is the basic principle. You've done the occiput, you do the neck muscles. So you do the neck muscles after doing the occiput. I'm doing the muscles here. Muscles of the neck. Then where the joints are, do them very gently but firmly. Then move on to the trapezius muscles, top of the shoulder. This is the shoulder blade, scapula, just above that. Very important to do this. Massage all along the spine here. Even though it's a neck problem, you have to do these areas as well. This for about 5 minutes. Get rid of the muscular spasms, the lactic acid that accumulates in these areas, and get the blood flowing in with more oxygen, more glucose, to get rid of the inflammation. Whenever you have inflammation, there's lack of blood flow. And so all these anti-inflammatory drugs, non-steroidal, they make the blood thinner so that the blood can flow more easily to the inflamed muscles. So by vibrating and massaging, you can achieve the same effect of relieving inflammation. Now, if you don't have a massager like this, then you have to use your hands. So apply a bit of oil, as lubricant. So you start off with the occiput. Use your thumb and your fingers to massage the occiput. Do that deep enough so that you rub the tendons of the neck muscles and get rid of the inflammation, because the neck muscles, they tighten up whenever you have neck problems, and the tendons at the end of the muscles, they get then inflamed. So then you do the sides of the spine where the joints are, massage it like that. Again, stay behind the ears. So massage it like that. On the other side as well, massage it. Then between these joints and the central part of the spine, you have the muscles. So massage the muscles. You'll find various types of cord-like muscles in spasm. So you massage them to relieve the tension in them, both sides. You can literally feel some of the cords, the muscles which tighten up and become very firm. So massage those areas. Massage them till the pain is eased, or about 4 minutes. Where the joints are, massage where the joints are, and then go inwards. And the top of the spine, the axis, you hold and you shift it left and right like that. Very gently. And go to various parts of the neck wherever you find tight muscles, spasmodic muscles, relieve them, press them, and knead them. Get more blood into it. Circulation is the main thing here. More blood you get into an affected joint, muscles, ligaments, tendons, the better the healing is. Then move on to the trapezius. Pinch it like that. Pinch it like that. The trapezius is an important muscle that pulls the head back and keeps the spine erect. So if you've been using computers a lot, or if you've had some whiplash injury where the neck is affected, or you've been very stressed or insomnia, then you need to work on the trapezius and the muscles of the neck. Of course, we go down to the upper spinal muscles. This is the spine here on either side. Go behind the ears, massage this area here, just below the ears, and on the other side. You place your fingers on either side of the spine and you move the joints slightly, very slightly, left and right. This will help the blood flow to the brain. Treat the second type of problems, which is fatigue, in this particular case headaches, visionary problems. The muscles feel nice and warm because you've got blood into it. It's changed the color, it's become red. So more blood has gone into it. Now we turn round. Now we turn over and we do the front side. So we start off with muscles of the jaw, because the jaw is stiff, the neck is bound to get stiff. So massage the jaw here. Release all the tension, both sides, for about 2 minutes. Then massage along the mandibular. It's going to be very painful, especially when you're stressed with neck issues, all along the mandibular. Keep massaging it. And the third line is located just below the rim of the mandibular here. So you massage the tendons which are attached, okay, very gently, all along the mandibular, but just focusing on the tendons there, of the muscles. So you do the jaw muscles, the rim of the mandibular, and just below the mandibular here. Don't do any of these areas here. There are some important blood vessels, so stick to the bony parts. After you've done that for about a couple of minutes, then you massage the sternocleidomastoidus, which comes from the mastoid bone here and goes to the sternum. So this muscle here, there. You'll find the muscle just below the ears here. Then you go to the collarbone and you massage here where the sternocleidomastoidus is attached. Collarbone. After doing that, release the tension in the pectoral muscles here, the tendons of the pectoral muscles which are here, because the pectoral muscles, when they get tight, the shoulder gets raised, get round shoulders. Go back to the muscles of the back from this end, staying behind the ears, of course. And then a little bit here on top of the clavicular, collarbone, trapezius from this side. Move the head to one side and massage this area. It's very painful. The neck is painful. You have the string of spasmodic muscles which need to be rubbed to get more blood into it, to get the inflammation out, to get the lactic acid dispersed by extra oxygen, blood flow. There's more pain on the left side, of course. It's hurting. Where these muscles are attached on the occiput area, you also try and massage those areas. And this side as well. If you stay behind the ears, you're absolutely safe. All the major muscles, the nerves and the blood vessels are in front there. These are all the inflamed muscles. They're hurting as I do them. But once you do them for a few minutes, the spasms go and you get a relief. They don't hurt anymore. Now we move on to the exercises of the neck. We start off with these. Put your hands behind the back, the other hand as well. Lift yourself up, up, up. 1, 2, 3, 4, 5. And up, up. 1, 2, 3, 4, 5. One more. Up, 2, 3, 4, 5. You must do 5 repetitions of each of these exercises twice a day. Put your hands here under the thighs, yes, and the same thing, up, lift yourself up, 2, 3, 4. Get a good grip of the shoulder here, and the other hand behind your back. Pull this forward and look back. 1, 2, 3, 4, 5. The other side. Pull this forward and look back. 1, 2, 3, 4, 5. One more. Pull. 1, 2, 3, 4, 5. So you do 5 in each direction. 2, 3, 4, 5. Okay. Now the head roll. Roll the head like that. Yes. 1, 2, 3, 4, 5. The other side. 1, 2, 3, 4, 5. So these exercises would be enough to help you with the shoulder problem. How is the shoulder? Exercises twice a day. Put your hands here under the thighs, yes, and the same thing, up, lift yourself up, 2, 3, 4, 5, down, up, 2, 3, 4, 5, down, one more, up, 2, 3, 4, 5, down. So these exercises should be done 5 times each, right? Okay, sit up. Bend your knees, lie on your back and lift the pelvis up, right up, and get the chin down to the sternal notch. Right, up, 1, 2, 3, 4, 5, down, again, up, 1, 2, 3, 4, 5, down. Let's repeat one more time, up, up, 2, 3, 4, 5, down. Okay, now the second exercise is look to the left and drop your knees to the other side. Yeah, keep pushing this and drop your knees to the other side. Hold it, 1, 2, 3, 4, 5. Then the other side. Move your, no, here, 1, 2, 3, 4, 5. Again, 1, 2, 3, 4, 5. 1, 2, 3, 4, down. Okay. How are you feeling now?
Good.